Hello, everyone. I am so excited about today's presentation for a couple of reasons. I love when we have the opportunity to talk about chiropractic in your community to other doctors and really open their minds and ideas to the wonderful things that you're able to do for your patients and the benefit to their patients in using you as a referral source. The other reason why I'm so excited today is because we have my dear friend, Dr. Stephen Weiniger, as our speaker today. And let me just tell you, I've had the great pleasure of knowing him for several years. He is not only one of my most favorite people on the planet, but he is an outstanding speaker. And if you attend one of his classes at a state association event, you are guaranteed to learn a lot and have a great time, because it's not very often that we go into these continuing education classes and you laugh and you get up and you move around and you learn something all at the same time. But that is the kind of experience you have when Dr. Weiniger is your presenter that day. For those of you who are not familiar with Dr. Weiniger or his background, he wrote the book on postural motor control exercise, Stand Taller, Live Longer. He is a faculty member at the University of Western States, created the free Posture Zone Assessment app, is the Certified Posture Exercise Professional Program, and spearheads the posturemonth.org. And if you have not visited this amazing site to get great information that you can use to promote healthy posture within your community for social media, you are missing out. So please check it out. I could gush all day about Dr. Weiniger, but then you would miss out on the great pleasure of hearing what he has to say today. So Dr. Weiniger, I'm turning it over to you.
Christy, thank you very, very much, and you are entirely too sweet, and you're making me blush, and I very much appreciate the kind words, and I appreciate you guys having me here on ChiroHealthUSA, helping to support our mission to position chiropractors as being the posture specialist in an evidence-congruent way that everybody can look at and say, yes, that makes sense. He's a chiropractor. This is what she does. She works with posture, especially considering some of the things like the new American College of Physicians recommendations. That, to me, is one of the keys to opening a door. It's like the biggest name in the academia from medical physicians in terms of how the primary care PCPs practice said to them, stop taking care of back pain the way you used to take care of back pain. Instead, send them to somebody, and that somebody should be the chiropractor, and the opening there is tremendous, but that requires opening the door, and this is one of the things that we'll be talking about today. So with that, let's move along. Beautiful. This past March 2018, the Lancet issued a global call to action on the global crisis of low back pain. This wasn't one article, this was a series of 4 articles because, among other things, low back pain is the leading cause of years lost to disability, and its burden is growing globally alongside the increasing and aging population. And even though Lancet is the top of the heap globally for medical and healthcare research, this is something that is affecting the States and everywhere. But most of your patients, and probably most of you, don't read Lancet every issue. However, your patients very often are seeing Good Morning America. And the day that this was released from embargo from Lancet, because it was embargoed, which means that they can't release it until that date, all the major news media was covering it. And Good Morning America, this was one clip that I saw talking about new report warns of widespread ineffectiveness of lower back pain treatments. And they said that there's other things that are better than what they're doing, which includes things like spinal manipulation, massage. And if that doesn't work, then try NSAIDs of some kind for maybe up to 2 weeks, but not to have it being an ongoing issue. And if you want to know more about the Lancet study, I suggest you take a look at the July 731 of 2018 issue of Chiropractic Economics. And they have the cover and the feature article in that is by me, Stephen Weiniger, a chiropractic perspective and opportunity. Because one of the things that Lancet called for was a positive health concept to prevent low back disabilities. And one of the things that I spoke at a seminar at South Carolina 2 weeks ago, a few weeks ago, just before they got flooded. Thank God. And not thank God that they got flooded. Thank God that I wasn't there for the flooding and getting stuck in that. I've got some friends that are still dealing with it, and the prayers are with them. But the frustration that two doctors expressed to me was that, well, we've been talking about this forever, and now they're saying it. That's not fair. And my response was, the message is being gotten. Your practice should be geared up to deliver that, so that you can say to everybody else in the healthcare world that, yes, that's exactly who I am. I'm the solution to that problem. And this is one of the things that we talked about last year in 2017, when the American College of Physicians, which is the membership organization for the PCPs and the internists and the primary care people, came out with updated guidelines about low back pain. This is one of the articles that was quoted by the Lancet study. But the American College of Physicians issued guidelines. Guidelines are different than regular studies, because in the hierarchy of research, there's a pilot study, a patient history, a randomized controlled study, and there's a meta study, which is a whole bunch of randomized controlled studies, and they're putting together what the best thing to do is based upon a lot of people's input. And at the very, very pinnacle of this pyramid is guidelines. Guidelines are when the people that are part of the colleges of academia and the organization of the American College of Physicians, not one college, but of all the people teaching, saying this is the right way to do it based on all the data that we have. And the American College of Physicians came out with updated guidelines that was on the front page of the health section of all of the major media, Wall Street Journal, New York Times, Washington Post, and basically the headline in the Wall Street Journal, big headline, no drugs for your back pain. And one of the things quoted was that things like long-term NSAID use leads to cancer. That was from a different source, and that was 2011 from that graph is from Dynamic Chiropractic. But this is an issue that's been going on for a while, and they basically said stop using prescription as well as over-the-counter NSAIDs, as well as Tylenol, as well as opioids. Oh my goodness, I'm a PCP. What do I do? What do I take? Well, instead of doing those things, what they're recommending are passive therapies like chiropractic and massage, and active therapies, not just any exercise, but exercise that's specific in quality of movement, things like Tai Chi, yoga, and something called motor control exercise. And if you don't know what that means, you should. It's abbreviated MCE. And the strong posture exercise that we teach are motor control exercises. And this is a huge opportunity for chiropractors, as well as those working with massage therapists, to be able to brand and communicate using posture as the big post of who you are, what you do, and how you can talk to the public as well as others in healthcare. If you saw the front page of Dynamic Chiropractic, when this was on the front page, building the DCMD bridge, we talked about how communication is key to earning, underscore the word earning, medical referrals. Apologies for this slide, but basically this was put out by the president of the International Association for the Study of Pain, and they said that surgery generally for back pain is the wrong treatment, as are opioids, and that most people responded better to exercise and cognitive behavior therapy. Cognitive behavior therapy is basically a psychological therapy to learn to connect with your body and your motion and your behaviors more effectively. In pain scoping skills, we talked about moving differently to rewire the brain, to train the brain to respond and to move differently. And there's cognitive behavior therapists and psychologists that work in that world, but that's not a world of a chiropractor. I'm a doctor of chiropractic. I started practice in 1980. And all along the way, we've talked about posture. And when you talk about posture, people say, yes, that's important. A European Spine Journal study found that 89% of primary care physicians consider biomechanical risk factors like posture to be the single most important short-term trigger for sudden onset low back pain. And it's also a potent factor for chronic low back pain. One of the things that happens, though, when you talk posture, you need to talk about it in a framework that makes sense to everybody, not just to us as chiropractors. And the goal is communicating an interprofessional message that everyone gets to build credibility, and then to go on with working with the person ultimately towards wellness, but first addressing the pain. And with that, I'd like to focus a bit more on what an adjustment, because when they say SMT, spinal manipulation therapy, is good for low back pain, they are not saying the word chiropractic, they're saying the word spinal manipulation. So talking about what an adjustment does, spinal manipulation unlocks mechanical restrictions. It also stimulates neural proprioception, and it helps to neuralize neural function. It makes a neurologic change as well as a mechanical change. However, and this is where some people don't stop to look at what's going on, and some people may disagree, an adjustment is passive therapy. Active and passive refers to what the patient's doing. Yes, you're active when you're giving an adjustment, but the patient isn't. They're just laying there. They're not retraining their neural patterns in how they move. And those neural patterns in how they move have been trained by how they have been moving. So an adjustment, spinal manipulation, is a passive therapy that doesn't, in and of itself, actively retrain motion patterns. It also doesn't alter someone's postural environment. The postural environment is how you live, the chair you're sitting on, the desk you're working with. It doesn't change that. And this is why it makes sense to be looking at the person's postural environment. And it's one of the messages that we have with posturemonth.org, and which is part of our public awareness campaign for improving posture health for everybody. And the basic message is we help people strengthen their posture. We remove restrictions with chiropractic, and we restore control and retrain patterns of movement with strong posture motor control exercise. Teach people how to move towards symmetry and towards accuracy. And the strong posture BAM, or balanced alignment motion protocols, are systematized rehab protocols that address people from pain control to performance, wellness to aging successfully in a way that's progressive, in a way that you're individualizing those exercises to the person, whether it's for insurance, but especially for personal pay patients. And if you've read Stand Tall, Live Longer, you know that that's a consumer version of the book, of these ideas, and that sets out a biomechanic communication frame using 5 posture principles, and talking about how it makes sense to keep your body moving because your body's designed to move. And as part of teaching people a biomechanic framework to understand it, we're teaching them motor control exercise. Okay, let's back up just a little bit. What is motor control exercise? And as I'm going along, if you have any questions or comments, please put them in, and Christy will be asking them at the end. But motor control is a specific kind of exercise. Putting somebody on a treadmill, they are moving, and yes, they have some control of their body, but they don't have mindfulness, and they don't have what's called attentional focus. So what a motor control exercise is, this is per Shumway Cook-Wollicott, who's probably the global authority on research and clinical practice for motor control exercise, is how this CNS organizes muscles into coordinated movements. So that's basically the motor side of things. How this sensory information is used to select and control movement. That's the sensory side of things. And how our movement patterns are influenced by our perception, which is the both cognitive and sensory motor reflexive part of motor control. which is one reason why it fits into the cognitive behavior therapy. In fact, strong posture could be considered to be a somatic or body-centered cognitive behavior therapy by focusing on the beginning point of all motion, which is your posture. Posture is a framework that people get. They know it's important. Grandma said it was important. Mom said it was important. And common sense says it's important. From a global point of view, there's three real purposes of your posture. From a locomotion point of view, because you're a biped, you've got to stay vertical to move. Yes, you can crawl, but it's way less effective. And we'll do that in an attempt to avoid or to minimize pain when there's a problem. So the first purpose of posture is staying vertical as you move. The second is keeping your eyes where you can see what's going on and keeping the world that you're looking at eye level, whether that's a computer screen or walking down the street. And you will shift your posture so that you can see what's going on. If you ever tried to look through a hole in a wall or something, you couldn't see through it at eye level, you scrunch down and you're changing your posture. You're not thinking about it, but the reflexive changes across the kinetic chain to lock into visual is why you're doing that. And there's another really big purpose of posture: breathing, respiratory, because your rib cage has to move, the core has to move, something has to move for you to pull air in and out. If you don't, game is over. And when we talk about the functional strength of your posture, within the constraints of being able to breathe and see where you're going, the strength of your posture is your ability to fight gravity and win. And we talk about motion, how people are moving. Erwin Core put it really well. Your body thinks in whole motions, not individual muscles. And while there may be an individual muscle that's weak that you can identify, it's not just the weak muscle, it's the weak recruitment patterns that create issues many times. People that are strong move the quote-unquote wrong way, something gives, something catches, something buckles, and there's pain. You probably know quite a bit about anatomy, but if I told you real quick, I'd like you to contract the multifidus on the left side between L3 and L4, you couldn't do it. You don't have that granular segmental ability to control your body. If I told you to bend your torso to the left, no problem, I can do that. Your body thinks in whole motions, not individual muscles. The ACE framework, if you go to posturemust.org, you'll see more information about the ACE framework. StrongPosture.com right now is being updated to have that as being another place that this framework is being put out there. But we've been doing this for the past 2 years. If you are not getting the tools for the annual May is Posture Month campaign, you want to get it, go to posturemust.org and sign up, and you'll be on the list for the 2019 program. Because ACE stands for building awareness, retraining control, and building an intelligent posture environment. So awareness, control, environment. And awareness is usually important and key, because when you look at someone's posture, if you just take a picture of it, and you can do it with just the regular old camera on your phone, you can show them how they're standing when they think they're standing straight. And that's the beginning of building awareness. Measuring and documenting it and connecting that with the biomechanics of their pain connects your words with their reality. And a picture is worth 1,000 words when you talk to somebody, although a minor caveat here. There's some things out there that people pathologize posture and make it into a disease. Posture is functional. There can be pathological conditions, but many people with a postural weakness can be strengthened. And if I tell you that you need to go to the gym because your muscle tone is not as good as it should be, I can make it into a pathology saying that you've got a sarcopenia or a muscle wasting disease, but it's really not a muscle wasting disease. It's just you need to be using it to keep it. And this is why it's so valuable to be able to have a framework to communicate with other healthcare providers, to simply observe the accuracy of the self-aware postural alignment and symmetry by measuring how 4 posture zones, the 4 body masses, head, torso, and pelvis, are balancing over the center of pressure where the feet are in the middle, and observing the angular deviation of head, torso, and pelvis over your feet. And this is even more hugely important now because of devices. You've heard of tech neck and computer back and setosis and all these new things that are being coined to describe what's happening in society as people spend more time on their devices. This is a picture that was taken 2 weeks ago from an article that they were talking about a Chinese video game company and the effect that it was having on the stock of the company. So they took a picture of a bunch of kids playing games. This is not about posture. It's not trying to demonstrate posture. This is the way a group of kids look, quote unquote, normally when they're playing video games. Look at these kids' posture. The one young lady on the left looks like she has some awareness of her body as she's bending forward from the waist. And while it's not great, her head is more or less lined up with the shoulder. All the rest of them, especially the right side of this, those kids are training their bodies to be into a seat. You'll notice what she's doing, she has her legs crossed to bring her hands back up so she's not flexed so far forward and able to maintain more of a hip hinge of torso-pelvis alignment. As this generation ages, these problems will get worse. The Journal of the American Academy of Orthopedic Surgeons have said that although traditionally it's been accepted that back pain in young children and adolescents most often has an organic etiology, non-organic back pain in this population is becoming more common. And that was in 2016. This problem is getting worse. There keeps on being more things about older people as well, talking about sitting is the new smoking, the toll of sitting all day. Our message, and yes, that is me on the right, is by strengthening your posture, you can help a body age better towards a positive health concept for everybody. And that's what a chiropractor can be doing and should be doing. And the ideas from the book Stand Tall, Live Longer were designed to facilitate that with 5 ideas, 5 posture principles. The first thing is motion. Your body is designed to move, but that motion is under control of the control system of the body's motion, which consists of all of the neurology, including the CNS and ANS, autonomic nervous system, as well as peripheral nervous systems, with both feedback and feed-forward mechanisms. And one fact from a low back pain study that's been demonstrated a whole bunch of times, this was from a 2014 study, automatic postural contraction of the transverse abdominis, which is a main core muscle, observed in the control subjects in the sitting and standing postures, was not demonstrated in patients and subjects with chronic low back pain. And this is one of the points. People with chronic low back pain move differently. They stand differently. They stabilize differently. And the muscles are moving differently. But it's not just about strengthening a muscle. It's about strengthening the recruitment patterns of those muscles. And those recruitment patterns, to a degree, can be observed by just looking at how someone's standing. Because if someone's standing posture is asymmetric, is compensatory, and their perception is, yes, I'm standing straight, the disagreement between their perception of postural alignment and symmetry and what you're objectively observing compared to reality is a way to visualize errors. And I'm not talking about a slight difference. This is a person, his posture is pretty decent. His head's 0.3 degrees to the left of where his feet are. Anything less than a degree is fine. His torso, he's got a bit more torso deviation to the left, it's 9.4 degrees, than he does to the right. Again, it's less than a degree. It's not relevant. Pelvis, 9.9 degrees to the left, 9.1 to the right, less than a degree. Nothing that I'm going to get upset about. When you start seeing people with better than a degree deviation on the front or the side between 2 posture zones of head, torso, pelvis, it's a way to see where somebody's body is, and it's a way to give them 3 simple numbers from each view of where the body is in space and how they're balancing and connecting their perception to reality by measuring that postural deviation from the center, from the front, and from the side, because you're looking at how the body is shifting in order to balance and the patterns the body's motion is taking in order to balance. And poor posture creates adaptive motion, and adaptive motion trains poor posture, as well as poor balance. It's a vicious spiral with posture breaking down, making balance weaker, And as balance breaks down, your posture breaks down. This is one of the things that's going on in the falls world because there's a tremendous correlation between postural breakdown and an increase in falls. And there was another article that we did with Professor Enix from Logan College that Tara Echo had also earlier this summer. Take a look at it. Or drop me an email. I'll be happy to send it to you. That talked about the opportunity for chiropractors in geriatrics and fall prevention. And that's probably a good subject for a later webinar with ChiroHealth Christy. We should talk about that. Because the motion degeneration that's at the center of both posture and balance breakdown is not just of the muscles, it's not just of the joints, it's not just of the nerves, it's all of them. It's a structure and function issue that spirals down as you move worse, more flexed. In posture, your balance gets weaker. You shift more in order to be able to maintain balance, and your body keeps on literally collapsing and folding as you age. What can you do? We encourage people to incorporate strong posture exercise into their routine, and that's what we have doctors across the world teaching how to help people strengthen their posture. And you can get into more details with it. There's both open and closed chains and deep and superficial chains of motion, but they all move in patterns that follow the path of least resistance. If there's a flexible link in the chain and a tight link, you're going to use whatever is more flexible, and you're going to engage the muscles that are stronger across that chain and avoid the muscles that are weaker, as you favor your body in whatever that pattern is. So the last two principles that we talked about in Stand Tall Live Longer are compensation, that's functional, which often sets up a pain cycle of injury setting up pain, making the body compensate, and that compensatory motion sets up unbalanced motion, which sets up the next injury. And adaptation is when this becomes a structural change where over time, changes in posture and changes in motion cause your body to physically change. The process keeps on getting worse, but the adaptation is a two-way street. You can make it spiral negatively down to buckling down, or you can take it the other way, in what we call building a strong posture motion cycle, where aligned strong posture and more symmetric balanced motion and movement means all the exercise you do, from walking to get the mail, to going to the gym, to going cycling, to whatever, is done in a way to force you to engage the core muscles towards symmetry, towards objective, accurate symmetry, not your perception, but what something external is, which is what the strong posture exercise are teaching you, how to connect with an objective external cue. And that helps you to train that strong posture. When you think about it, your posture is how you balance your body. That's the second posture principle. And if you think about it again, this is from some of the posters that we use. If somebody is standing vertically and they've got a high shoulder that's 3 inches higher, if you look at it from that way, but that's really not saying how far they're deviating off from center line. Or if you've got a difference between the left and the right of 3 degrees, which is quite a bit, which my world would say that, yeah, you've got a lot of deviation in how you're standing. On an overall biomechanical basis, is that person balanced? Think about it for a second. If someone is standing and they're pretty wobbly when I'm looking at them, on an overall biomechanical basis, is that person balanced? If the answer that you're thinking right now is no, of course not, they're not balanced, I would challenge you to answer the question why they're not falling down. And you would say, yes, I know, but it's not good posture, it's not ideal posture, and that wasn't the question. The question was, on an overall biomechanical basis, is that person balanced? And you'd grudgingly say, well, yeah, I guess they are balanced overall, but it's not good. Exactly. It's not good. That's the problem. Your posture is how you balance your body. It's what you're doing to maintain verticality, which is why I'm looking at a tool to measure the deviation from vertical of those masses and being able to go back and generate a report with those numbers and adding other numbers to it for different lines. You're doing any kind of ergonomic work or sports work to be able to observe what the body is doing. And that's something that makes sense to anybody, especially if you explain to them in a way that they haven't thought about posture. You can build value. And the Posture Zone is a free app for patients. It's a free app for you if you want to download it, play with it, and try it. You can't generate reports from the free app. The paid app is $29. It's one time. There's none of this annual fee for or per use fee or membership fee for using an app, because we think everybody should be taking pictures with an app. And if you are teaching strong posture exercises and you've been trained and tested, that's the certification that we do. This disclaimer, this is our economic. We teach people how to do strong posture programs and strong posture rehab. And the certification is a CPAP or certified posture exercise professional. And these are people that teach strong posture motor control exercises. And I got to tell you, when you go into a medical doctor and you explain posture like this, and then you tap the button in the app and they see you there, and they see doctors all over the world that are doing this, you look like you're part of something bigger, because you are. And the idea is building a protocol with the strong posture BAM tracks of balance, alignment, motion, of building that virtuous spiral, build a motion cycle, along with removing restrictions, which is what I do with an adjustment, and using this to consistently train the motion more accurately from how they think they're moving to reality, focusing their attention on one posture zone segment at a time, on one arc of movement in the motion and in the BAM tracks, to literally reprogram motor control on a neuroplastic basis, beginning with simply how they're standing, from an alignment, how they're balancing, and how they're moving, and building an awareness to consciousness. And yes, that's me, and that's I kind of like the looking forward to what can be down the road, and that's where I like to go kayaking. If you're ever in Atlanta or on the ChiroHealthUSA, give me a buzz. The game that we want to be doing is building aha moments systematically with patients. So you're building perceived value on their part as you're retraining how they're moving, so that they can feel it. It's not just showing them a slick video or a persuasive script, but having an experiential that the strong posture ideas, along with what they're feeling with the exercise, is building a positive spiral from awareness to consciousness by first connecting their perception to reality and connecting sensorimotor errors as you progress. And this is one way to create those aha moments, visually with the pictures and kinesthetically with exercise. And the practice model becomes one of posture care, acute care, get them out of pain. Musculoskeletal point of view, I'm not saying you can't take care of other issues as well, of course, but for most DCs, most of the practice is musculoskeletal, and most of that is back and neck pain. And when they walk in, their goal is to move pain-free, get out of pain. And as we said before, if you're measuring that and you're showing them what's causing the pain and connecting that image with your words, you're increasing their postural awareness. And if you're getting them connected with exercise, they're experiencing positive change. During acute care, if you're taking care of them with any reasonable insurance, you should be billing this to insurance. Yes, there are codes to do this, therapeutic exercise most commonly, but also group and other ones as well. And you're probably working with people on a rehab basis. I truly hope you are. And if you are, the goal then becomes moving well. But it's not just strengthening you to get you back to quote unquote normal. It's strengthening your posture. That's what anybody should want to do in our society. And when you're doing that, linking awareness with posture control, from the public's point of view, you can buy mechanics to brand you as a posture specialist by combining the Posture Zone app with strong posture exercise. And from the professional's point of view, from other medical providers, you're setting yourself up to communicate with them using those ideas so that they can understand why and what the patient that they're referring to is going to be seeing you and what you're going to be doing to that person and that you're not just setting up a long-term contract to see that person, especially if there's no insurance, but you have a defined goal to get them out of pain and to help them to help themselves in a way that they haven't seen. Because just like the American College of Physicians came out with updated guidelines saying less drugs, Lancet is coming out with guidelines saying we need to do things different, and there should be a positive health concept. Chiropractors should be at the forefront of leading this in the healthcare world. And promoting self-awareness and what's called self-efficacy, being able to help yourself by teaching people how they can observe the accuracy of their postural alignment and symmetry by measuring it with its simple numbers, not pathologizing it, but just, I thought I was standing straight. I'm still flexing forward a little bit. How can I help that? We're going to work on that with these exercises. And having a posture model, a practice model of posture care, from acute care, get them out of pain, to rehab, functional improvement, to wellness care, optimizing how you feel and perform. And using tools like in-office handouts, clinically, or from a public health to everybody, doing a 7-week program, that's what stands for Live Longer, was designed to facilitate, and promoting the idea of going to a posture specialist. And if there's a back pain, chiropractors are great for that. We've gotten much stronger awareness in the world, but in addition to that, promoting us as being posture specialists, not just chiropractors. And that's what we do. And so CPEP, this is our ad for what we do. We do online CE training. We do live training. If you're in Wisconsin, I'll be at your big fall conference this weekend, speaking on Friday and Saturday. Please come to my class and let me know that you were there. I'll be at Northwestern the following week. I'll be in London after that at the World Federation. But if you have a desire to connect with us, give me a call, drop me an email. We basically teach step-by-step protocols to stimulate results and referrals, and use the app to stimulate step-by-step referrals. And doing it in a way that is systematic, training you to incorporate things into your practice one step at a time. And there's a lot of stuff here, but the training and implementation modules takes one step at a time, from A, B, C, down to staff meeting agendas, to have a person appointed to be the one organizing it in the office, giving them a clear path of what needs to be done to pull you into a posture practice. If you just want to get started with what posture, with working with the Strong Posture Rehab program, the Rehab Kit has all the patient handouts, staff training book, a copy of Stan's Hall Live Longer, and a DVD of the beginning alignment exercises. If you like what we're doing and you want to do CPEP, it includes all the tools you want, including grids and other tools, as well as 15 hours of online CE and a bunch of other tools and forms and things that you're going to want in the members area of CPEP. So with that, I'd like to invite you to join us in being a posture specialist. In terms of the people from ChiroHealth that are here today, if you order the rehab box, it's regularly $229. It's regularly $249. It's on sale right now for $229. And I looked at this just when I went on. So if you want it now, you can order it on sale. I don't know when the sale's ending, but I will say that if you're thinking about doing it, to give you an incentive to act today, I would say you can order it on posturezone.com. You can give us a call. And if you say that you're on the ChiroHealth webinar, or you put that in the comments, they'll send you a free TheraBand ball. It's a $39 value. And just let us know that you're on the ChiroHealth webinar, or that Christy says hi. And Christy, I got to strike you for saying lovely things about me. I really do appreciate that. And with that, just drop me an email. You've got my name there, and if you want more information about our websites, that's who we are. And the thank you on top should have dropped down. It didn't, but that's more information on how to find the things that we do. And with that, Christy, are there any questions?
I don't see any questions. If you have any questions for Dr. Weiniger, please go ahead and submit them now. I do want to encourage you, there are just amazing resources available at posturezone.com. So go check it out. Check out Dr. Weiniger's website at bodyzone.com. You will not be sorry. Just a reminder, next week we are going to have Dr. Cindy Howard from Illinois talking about pre and post concussion nutrition. The following week, right in the middle of hurricane season, we have Is Your Office Prepared for an Emergency or Disaster with Dr. Fran Tugas. So if you do not have a disaster or emergency plan in place in your office, this is a must-attend webinar. So please check it out. I will just tell you from experience, we are in the middle of central Mississippi. We are nowhere near water, 3.5 to 4 hours away from the coast. However, Hurricane Katrina did affect many chiropractic offices and homes and businesses in our area several years ago. So even if it's a long shot possibility for something like that, it's a really great thing to have in place for not only hurricanes, but tornadoes, fires, flooding, any of those things that can happen. And it's just a compliance thing that you really need to have in place. Dr. Weiniger, I don't see any questions, which doesn't surprise me because you are such a thorough presenter. You do such a good job talking about these things. Really do want to encourage you, if you are like me and think of questions after the webinar is over, because that's what I do, email Dr. Weiniger at drw@bodyzone.com. This webinar was recorded. You don't have to request a copy of the recording. It will be made available to you for 1 year from today. You will get an email about that webinar recording and how to access it in the next 20 to 25 minutes. So be sure to share it with other people in your office who you think, or even some of your colleagues you think could benefit from the information that Dr. Weiniger shared with us today. Dr. Weiniger, I am counting down the days until I get to see you on the road again.
I look forward to connecting again very soon, although I'm probably not going to see you again until next year, am I?
You're not, and it breaks my heart.
Well,
although I might. I was just going to say I might just try to sneak into your luggage and hop across the pond with you when you go and peek it overseas.
If not that, if you want some warm weather, I'm going to be at Panama City for FCA in I think February or January, something like that.
Yes.
And if you can have Dr. Foxworth take you there, I'm sure coming out to the beach then would be a good thing from your point of view.
I think it would, and so as long as I get to see you, that's a positive in my book. So everyone, have an amazing rest of your day and a fabulous week, and we'll see you next week, same time, same place. Bye-bye.
Bye all.
Dr. Weiniger?
Yes, I'm here.